Everyone. So my name is Marielle, and I'm here to talk to you about my research and mentoring in the nursing field. First, I want to talk about what is mentoring. So mentoring is having someone that will help you grow professionally and help you develop your skills. And if you have any questions, this person will be there to guide you. The mentor has knowledge behind the field that you're in, whatever career it is that you're in. And they're there to be with you through hard times. And also it helps create relationships, which is great. You're at work more than you're at home. So that's something that is very, very important. Background about nurses. So nurses are said to be the heart of the hospital. They're there all the time. I know doctors are very important, but nurses are the ones who spend the most time with patients. They go into this field because they want to provide patient care in the most difficult times. And it can be a very difficult job emotionally. So why is it important to have mentors in nursing? So let's talk about having a mentor program in the nursing field can give the nurse an opportunity to be successful at her job, his or her job. Starting a new job just out of school, you may have a lot of questions, especially going from one specialty to the another. There's going to be questions you're going to have to make sure that you're providing the best patient care you can. And also, you don't want to cause a patient harm if you're completely on your own and you don't have anyone to ask questions to. To create a mentoring program. So the first step in creating a mentoring program is to introduce this concept to the existing nurses. They're the ones who have been there the longest. And yes, sometimes it's hard to start a new program from scratch, especially with people that have been there for a long time. It's hard to introduce new ideas. But to make sure this is successful, we have to emphasize the importance of what it means to be a mentor and the importance of the success of their new coworker, because this just means that their workflow is going to go so much more smoothly and they can make sure that they're providing the best patient care. So how can we make sure that these mentors succeed in this program? So making sure that the mentor knows that they're supported by their supervisors in case they have any questions. And sometimes, there isn't a right fit. So they have to make sure that they know that they have someone to go to if they feel like they're not in the great mentor-mentee relationship. And making sure that they have great communication skills. And in order for all this to work is to make sure that the supervisor are aware that these groups are made and just follow up with them every so often just to make sure, ask them questions, how is it going? And this will make sure that this program succeeds. So like I mentioned before, there are going to be some potential problems. So some nurses may not get along, which is normal because you're at work more than you're at home. So there's always going to be room for sometimes some conflict. And like I mentioned before as well, some nurses may feel like this may be a little bit of extra work for them, which if they incorporate it, if they're workmates, if they're on the same floor, it may not even be extra work because you're doing your normal work and they just may come up to you and ask you questions. And that's how you're going to be helping them when you are a mentor. Make sure that you have great communication skills in order to make this relationship work. So there are solutions to these problems, and that way this mentor in the nursing field can work. So a little bit of my personal experience. The reason why I believe in having mentors in the medical field, especially in the nursing field, is because I've had a little bit of experience with this. So I have been a medical assistant for the past 7 years, and I worked in several different offices, so I floated around. which meant that whenever help was needed, I would get sent to that office. So for me, when I first got hired, they assigned me a mentor. And that person helped me answer all these questions. Yes, I went through my onboarding training. But that wasn't enough. The training just showed me how to use their computer system. It showed me how to do all the technical things. But when it came down to real patient care, you need someone that's had experience. You need someone that has gone through problems that your supervisor may not even know about and can help you, guide you in order for you to be successful at your job, especially to prevent patients from getting harm. So having this experience, I know the importance of having a mentor, and I also have mentored other new medical assistants. And I know that for me, knowing that I made a difference in someone's career is extremely important to me, and it made a huge difference, and it helped me grow professionally as well. So this is my research about having mentors in the nursing field and why it is so important. Thank you.